Welcome to LexCura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of LexCura Summit. Known risk of the procedure is one of the most effective defenses in surgical litigation and one of the most clinically vulnerable. In many post-surgical cases, the real question is not whether the complication was possible. The question is whether it was recognized promptly, monitored appropriately, and treated before preventable harm occurred. The postoperative record often contains the answer. Nursing assessment frequency, vital sign trends, pain and neurological findings, laboratory results, provider notifications, escalation protocols, and response times show what the care team knew and what they did next. In this episode, I will explain how to shift the analysis away from the procedure itself and toward the postoperative course, where the strongest evidence of breach and causation may be found. Okay, so here's something to think about. Every year, thousands of patients leave the hospital after surgery, trusting that they're on the road to recovery. But what happens when the system fails them and those trusted processes break down?
That's a heavy question, but it's one that needs to be asked. Today, we're diving into post-surgical negligence, what it is, how it happens, and why clinical records are often the key to uncovering the truth.
Exactly. Post-surgical negligence is one of those topics that doesn't get nearly enough attention, but it has life-altering consequences for patients and their families. And the thing is, proving negligence isn't as simple as pointing to an outcome and saying, "This went wrong."
Right. It's about connecting the dots between what should have happened and what actually happened. And that's where clinical records come in. They're like a roadmap of a patient's care, showing every step along the way.
Or in some cases, showing where steps were missed. But before we get too deep into the role of clinical records, let's start with the basics. What exactly do we mean when we talk about post-surgical negligence?
Great question. Post-surgical negligence refers to situations where a healthcare provider fails to meet the standard of care expected after a surgery. That could mean not monitoring a patient's recovery properly, missing signs of complications, or even failing to provide clear discharge instructions.
And the consequences can be devastating. We're talking about infections that spiral out of control, complications that go unnoticed until it's too late, or even preventable deaths.
Exactly. But here's the tricky part. Proving negligence isn't always straightforward. That's where clinical records come into play. They're essentially the story of a patient's care, documented in real time.
And that story can either support the actions of the medical team or expose gaps and oversights in care. It's fascinating when you think about it, how these records, which might seem like dry administrative paperwork, can hold the key to understanding what really happened.
It really is. But for those who aren't familiar, let's break down what clinical records actually are. What kind of information do they include, and why are they so important in cases of post-surgical negligence?
Clinical records are incredibly detailed. They include everything from a patient's medical history and test results to the medications they've been prescribed and the notes taken by doctors and nurses during their care. They also document things like vital signs, any procedures performed, and even the patient's progress notes.
And when something goes wrong, those records become evidence. They're used to reconstruct the timeline of events and determine whether the standard of care was met.
Exactly. For example, let's say a patient develops a serious infection after surgery. The clinical records might show whether their vital signs were being monitored regularly, whether there were any early signs of infection, and whether the healthcare team took appropriate action.
And if those signs were missed or ignored, that's where the case for negligence starts to take shape.
Right, but it's not just about what's in the records, it's also about what's missing. Sometimes the absence of documentation can be just as telling as the notes that are there.
That's such an interesting point. It's almost like a detective story, where the gaps in the evidence can be just as revealing as the evidence itself.
It really is. And that's why these cases often require experts to analyze the records. They're looking for inconsistencies, gaps, or anything that doesn't align with what we'd expect from standard medical care.
But here's the thing. Clinical records are only as good as the people maintaining them. If they're incomplete or inaccurate, that can complicate things even further.
Absolutely. And that's actually a huge issue in healthcare. Documentation errors are surprisingly common, and they can have serious consequences, not just for patient care, but also for legal cases where those records are being scrutinized.
So, let's bring this to life with some real-world examples. Are there any cases that stand out to you where clinical records played a key role in proving post-surgical negligence?
Definitely. One case that comes to mind involved a patient who underwent a routine appendectomy. Everything seemed fine initially, but a few days later, the patient started experiencing severe abdominal pain and a high fever.
Classic signs of infection.
Exactly. The patient ended up back in the emergency room, where it was discovered that a surgical instrument had been left inside their abdomen.
Wow. That's a textbook example of negligence.
It is. But here's where the clinical records came into play. The patient's chart showed that their vital signs had been abnormal for 2 days before they returned to the hospital.
And no one acted on it?
Right. The notes from the nursing staff mentioned the abnormal readings, but there was no indication that the surgeon or any other physician had been notified.
So, the records not only proved that something had gone wrong during the surgery, but they also showed a failure to act afterward.
Exactly, and that combination was enough to build a strong case for negligence.
It's such a powerful example of how clinical records can make or break a case. But it also raises a lot of questions about accountability.
For sure, and that's one of the biggest challenges in these cases, figuring out who's responsible. Is it the surgeon, the nursing staff, the hospital administration?
And in many cases, it's not just one person. It's a systemic issue where multiple failures contribute to the outcome.
That's so true, and it's one of the reasons why these cases are so complex. They're not just about pointing fingers, they're about understanding what went wrong and how it can be prevented in the future.
Which brings us to an important point: prevention. What can hospitals and healthcare providers do to minimize the risk of post-surgical negligence?
There's a lot that can be done, starting with better training and education. Healthcare providers need to understand the importance of thorough documentation and the role it plays in patient safety.
And technology can help too. Electronic health records, for example, can make it easier to track and analyze patient data in real time.
Absolutely, but technology is only part of the solution. There also needs to be a culture of accountability where everyone on the healthcare team feels responsible for patient outcomes.
And that includes speaking up when something doesn't seem right.
Exactly. It's about creating an environment where concerns can be raised without fear of retaliation.
It's such an important conversation to have. And while there's no easy fix, awareness is a crucial first step.
Definitely. The more we talk about these issues, the more we can work towards solutions that improve patient safety and prevent tragedies.
Well, I think that's a good note to end on. Any final thoughts?
Just that clinical records are more than just paperwork. They're a lifeline. They have the power to protect patients, hold healthcare providers accountable, and ultimately save lives.
Couldn't have said it better myself. Thanks for the conversation. It's been a thought-provoking one.
Always a pleasure. Until next time. Thank you for listening to Lexcura Clinical Insights. A complication may be a recognized risk of surgery, but delayed recognition and inadequate response are separate clinical questions. The analysis should reconstruct the postoperative course from the recovery room through discharge or deterioration. That means aligning the nursing assessments, vital signs, pain scores, wound findings, laboratory and imaging results, medication records, provider communications, escalation efforts, and timing of intervention. The key is to determine when the complication became clinically identifiable, what the applicable response should have been, and whether delay allowed the patient's condition to worsen. That is how the analysis moves beyond the defense that the complication was known and focuses instead on whether the response met the required standard of care. For more clinical intelligence, litigation analysis, and practical guidance, visit LexCura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of LexCura Clinical Insights.